So if you want to know about Medicare, all you have to do is ask us, okay? And we will help you. My wife is going to be here today with me, but unfortunately, she hurt her back, and she had an injection in her SI joint and just a whole bunch of crap. So anyway, so I'm winging it by myself. All right. Little background on me. I come from Long Island. I'm a Five Towns boy. I grew up in the Five Towns. I moved to New Jersey when I married my wife. She was also from Long Island, but at 16, her father, who was a sales manager for Levi's, they made him move to New Jersey. So they booked out New Jersey, and I met Marsha out here at a wedding 52 years ago. Okay, and that's how long ago. I started out after college from the University of Miami, where I played baseball, but no one go into that. I just did play. And I started after college working for a TV station in Florida, and then didn't quite work out. My family had a liquor store in downtown Brooklyn. Sold a lot of wine in those days before it became popular, before Boone's Farm and Iago Sangria and all that crap back then. And I wound up working with my dad for 6 years. Then I went into the wine industry on my own. I stayed in the wine industry till 1991, when I said, this is crazy. I'm not making a whole lot of money. I'm brokering wine. I'm flying all over the East Coast. And a friend of mine came up to me and said, you would be good selling health insurance to the self-employed. I said, Dave, sure. No, not for me. So he said, just follow me for 2 days. Followed him for 2 days. I said, okay, I'll get my license. I'll substitute. I will also do this within my wine industry. Well, long story short, 1992, I made $96,000 selling health insurance to the self-employed. I never looked back. I sold my book of business in the wine industry, but to this day, I still collect wine. I've got about $500 bottles of wine in my wine collection. Some very older wines. So if anybody wants to know how old some of these wines are, I will tell you privately. But how did we get into Medicare? Well, we started health insurance in '92. Somebody came to me at a continuing education class and said to me, you'd be good selling Medicare. I said, what's Medicare? So he said, here's my card. Why don't you call Louise over at United Healthcare and ask her to have a meeting with you? I said, okay. So I took the card, I put it on my desk, and this is the truth. It sat on my adding machine for 2 weeks. I didn't do a damn thing. One afternoon, I said to myself, I'll call. What the heck? So I got Louise on the telephone. Louise says, we're having a meeting tomorrow. Come down. I said, can I bring my wife? She says, sure. The more the merrier. So we went down there. We heard their spiel. And we said, okay, we'll sign up. We'll see what we can do with everything else that we were doing at that time with small group health, life insurance, etc. Well, long story short, the first year out, when this was still, I would call the Wild Wild West with Medicare Advantage and Medicare supplements, we sold 500 pieces of business. Never looked back. 20 years later, 25 states were selling business in. The Medicare world has become more complicated, more compliant than I ever thought. So if anybody ever thinks about going into the Medicare world and selling Medicare, don't do it. Yeah. I'm advising you. It's just, for instance. Yes.
Maria says it's good to go.
Okay, so
For that brief intermission. Next year.
with all the complications and everything else, everybody in this industry says, you know everything. Well, I don't know everything, but I read a lot about it. Why do I read a lot about it? Because Medicare industry is very compliant. You have to know Bob can vouch for Bob over there, how compliant it is. Barry knows with the insurance industry. But CMS, which is Center for Medicare Services, has gone overboard for this year. Why have they gone overboard? Well, plain and simple. Inflation Reduction Act, $2,000 maximum out of pocket for prescription drugs is causing chaos with the insurance companies because they're not profitable. So they start cutting back on plans, cutting back on dollars they're going to give them commissions, and all sorts of stuff across the country. So everybody's up in arms. NAHU, which is the National Association of Health Underwriters, and NABIT, which is the National Association of Business and Insurance People, have really gone down to Washington and are really fighting this whole thing so people can make money. There was a class action suit out there that stopped CMS from reducing commissions across the board. So, and marketing dollars. What Ellie knows with social media and marketing, okay, when you can't do that, you can't do anything. Okay, you can't do anything. But they try to do it. So a company called Integrity Marketing, which is the largest what they call field marketing organization in the Medicare field, put a class action suit. They stopped everything. Dead. Now I heard the day before yesterday that the suit will be heard in February, after annual enrollment period is over. Next week, October 15th, we start with annual enrollment period. That means people can change policies or change programs, okay? So please be aware, if you have friends, relatives, or anything, talk to a Medicare professional. I don't care if you talk to me or not, but talk to a Medicare professional, knows what they're talking about, especially this year. Especially this year, because guys don't want to get pinched in the business, don't want to lose a contract, lose your insurance license. You've got to be on top of everything, because somebody's going to make a phone call to CMS, and it's going to stop it. Another thing, every phone call that is made to our office has to be recorded, in and out. It's required by Medicare, so you have to get a phone service that will handle all that. So I can go back 10 years and listen to a phone conversation if somebody's trying to, say, we didn't say this. Well, we've caught a couple of people in their lies, but, it's what we do. Annual enrollment, October 15th to December 7th. You can make changes. There are going to be policy changes. Open enrollment, January 1st to March 31st. You can go like to like from one policy to another in the Medicare world. And then we have the SEP, special election periods. That means people who are retiring can get a policy as long as they get their Part B, okay? And on top of that, there is a FEMA SEP. Now, you're having a hurricane in Florida. Hopefully everybody will be fine. But that will qualify as a FEMA SEP, that people can change plans during that course of the SEP, okay? One last thing, everybody got a business card of mine. On the back of the business card, there's a QR code. That's to my website.
Yeah.
Okay? Everybody be aware of that. And there is a blog on that website that comes out every month. So, and it will teach you about Medicare. Okay, I'm done. Yes, Bob? I can go on for another hour.
First, I've worked with Bruce for a number of years. I used to do what he does before CMS got crazy, and I decided to get out. I sent all my folks to Bruce. He took care of my stuff as well.
Your brothers?
My brothers, my sister. I mean, anybody who's aging out, who's turning 65, make sure they talk to Bruce. Not so much to do business with him, but to get information so that they make sure that their insurance is doing what it's supposed to.
There's a lot of rules and
It has
regulations.
become so complicated, it's out of sight. And I can't say enough good things about how Bruce uses it. So.
One thing, if you continue to work past 65 and you're on health insurance plan at work, you only need Part A of Medicare. You do not need Part B unless your company has less than 20 employees. Then you got to get Part B. So it's kind of crazy, that kind of stuff. Yes, dear.
What's the difference between Part A and Part B?
Okay. Part A is hospitalization. Part B is doctor's offices. Part C is Medicare Advantage. Part D is prescription drugs, standalone. And then there's Medicare supplements. Okay.
So how far in advance do someone need to see you?
Okay.
10 years before they turn 65?
Wow.
5 years?
The rule of thumb to sign up for Medicare is 3 months before your birthday, the month of your birthday, and 3 months after, without a penalty. I have been suggesting people now to sign up 4 or 5 months ahead of time, because Medicare is very slow issuing Medicare cards, and you got to get on top of it, especially if you're gonna have a situation where you need to go down to the Social Security office to do it, and then it gets more complicated. So you do it online, Medicare.gov or socialsecurity.gov, you sign up.
They're penalized.
There's a penalty. After 7 months, there's a penalty. The penalty can be anywhere up to $545 a month. Yes. So you've got to do it right in that 7-month period. It sounds crazy, but that's what they do. It's like if you take a drug, you don't take a drug plan when you buy a Medicare supplement, there's a penalty every month for the rest. Here's the penalty: 1% on the actual annual average cost of a prescription drug plan times the number of months you have not been on the drug plan, and that penalty is for the rest of your life every month.
This is why you need to make sure.
You're right.
Sorry, are you saying that if you don't register for Medicare in that time frame?
You get a penalty.
For the rest of your life?
Yes, there is a
for the rest
penalty.
of your
Yes, sir.
life.
Yeah, for the rest of your life.
What age does it kick in?
65, unless you have SSD or SSI, Social Security Disability.
What if you have health insurance provided in retirement, like me?
Okay,
I
Right.
supposedly have it for life through the night shift plan.
okay.
Do I
Now,
still have to
here's
file
my
my
question that I
65?
give to everybody. All right, is it coming out of a pension plan? Your payments for the health insurance
Provided by the state.
by the state. So it isn't coming out of your pension?
No.
Okay, it's not. So you continue with what you got as long as the coverage continues, good. Okay,
No penalty.
no penalty. No penalty.
So my parents are in are in their 70s and 80s. Can you help them make
Absolutely.
sure that they're doing
Yes.
the best thing?
Yeah, we can do people in their 90s, so, especially the lady that drives from New Jersey to the Hamptons every weekend. And that's true, she's 93 now. Every week she goes to visit her kids in the Hamptons and she drives. And her son yells at her for driving.
So if they're on their social security income by 65, there's no problem, because they automatically.
If you take Social Security at 62, all right, and you can't, unless you've got disability, you can't take Medicare until 65.
Right, but you still have to sign up at 65.
Still have to sign up. Part A is an entitlement. That's automatic. And if you don't sign up, you're still gonna get a card in the mail, in all
Right.
likelihood.
Okay.
Okay.
So I just need to make sure my clients do that. I need to send it to you.
Yes. Okay. Yeah, there's all sorts of, you know, that we have to stay on top of. Yeah, so, yes, they do have to do that. Sometimes people don't realize that when they turn 65, they got cameras.
Yeah.
At least get the A, you know, if they're
They
still
have
working.
private insurance, so they still need to do it. They do.
Yes, because if you have your own plan, not a group plan, if you have your own plan, you automatically cut off from that plan at 65. Okay? You'll probably get a notice 30, 60 days ahead of time, but they're probably.
I like you.
Okay.
Anybody else?
One more question? No more questions?
Anybody?
Thank you.